first around changing education, we need to, and I saw there's a related question that I'll try to incorporate as well. We need to re-evaluate how we evaluate research and research outputs and education outputs. Is it research papers? Is it impact to society? And re-evaluate what's the role of education in its relationship with society and the impact it has there. Currently, impact to society is set at the background, and it's more about research publication. That's why we see a shift to this now, because currently research has to, and research that's been ongoing, has to come at the forefront and provide the new candidate vaccines or new therapeutics, and that's where the real need of research and education is put at the forefront. And I think from that perspective, we need to assess the relevance of research and how we invest in it a lot more from this framework, and really think and encourage the next generation to think of its role to society as such a provider of knowledge and to driving that innovation there forward. In terms of changes in education, we saw that we could do education remotely. And another thing I mentioned, education is tightly related to the human resource that we have in order to tackle such an epidemic, but also to tackle other kind of societal challenges that we might face in the future, whether they're infectious disease or something else. And we see innovation there where, as I mentioned, there are blended models that use the IT infrastructure. They use the human resource in other countries in order to provide teaching for others where might not have the facilities locally to do that. And I think we'll be seeing a lot more of this distance learning from the same way we've been seeing telemedicine as put at the forefront of how it would be possible to answer some of those diagnostic challenges. I think education will have to take such an approach as well. So I think the two main ways in which we'll see changes is first the way it's delivered, whether it's delivered always through a physical means of someone teaching you, or it can be done remotely. And this would actually provide access to people a lot more than we were able to do before, and will remove some of the barriers of lacking local educators to provide education. But B, I think it will change. We'll have to reformulate its role as impact for society, and that's how we would need to see it. That's how we need to deliver it. As I said, researcher and academic I've been for probably 10 years or so. And it wasn't until I went to Africa, and it wasn't until I tried to implement a solution I've developed in a country where I thought it would be best fitted, that I realized that it's not going to work, because it was this siloed view of it that sometimes research or only one sectoral approach to it provides. And I think education would have to really come at the forefront of this Sustainable Development Goals agenda, this research agenda, but we need to work a lot more with countries in the Global South to understand what the real needs are, to understand what the real gaps are in order for us to provide solutions through education and research. And on the second point about urbanization, I think the aspect of how education can be reformed through providing these opportunities for distance learning and for blended model would, to an extent, be able to be a path to solve that need for urbanization and for everyone to go to the big cities to find places to study or to work. In a way, if we manage to learn the lessons of that we don't need to be all at the same place to be working together, and in the same time, the fact that we are different places doesn't mean that we might not be facing the same challenges. I think these two lessons that COVID is teaching us now can really be incorporated in trying to find new ways of which we work and study.
Living on an island has got advantages, but also many disadvantages. And being a small country, we are totally reliant on import. And but now one thing as well is that the entire world now has become a supply chain. And this is something that I think has come has hit us very, very hard to realize that there is this interconnectedness, not just in terms of the supply chain, but in many other things as well. And I think this is something that we'll touch on when we talk about, the global aspect of how interconnected we are, be it in terms of biodiversity, in terms of diseases as well. So we as an island, we are totally dependent on import. And this also brings home something which is very important. How self-sufficient must we become, at least in our foods, in our food stocks, in our food supplies. And this is something that people now increasingly realizing that they need to go back to agriculture again. They need to go back to subsistence farming. If each one of us might have a small garden and at least get some of the basics food stuff there. Then in terms of how the economy is so dependent on everything else which is going on in the world, closing down our borders, going into isolation, right? The lockdown, as we see it, is going to have a huge impact on the economy as we will come out of it. Closing down the airspace has meant that tourism is almost dead, right? It will be so until, I think, beginning of 2021. So for one whole year, we have wiped out 23% of our GDP. 9 points come directly from tourism. And now if we add to it all the aggregate, we will reach almost 23% that's gone. So we can imagine the economy contracting by at least 10%. And that's a huge, huge blow to the economy. As previous speakers have said, not getting the remittance as well, because many people actually work overseas and they send money to Mauritius, to families. So this, of course, will be reduced. Although, in terms of the economics, I don't know to what extent, I don't have the exact figures, so I better not put any figures. But I know, for example, islands just next door to us in the Comores, for example, the input of remittance is very, very big in the local economy. So this is something that's going to actually touch a lot of us in terms of this issue. Food security will be an issue because of the border exchanges don't happen very, very quickly. And it will also affect all the important the staples that we are used to. But fortunately, we've had some reserve, and there has been planning in such that we will not be impacted too much. But having said this, as we are moving in 7 weeks into the confinement, we will increasingly have, for example, to fly medicine, for example, essential medicine, and that will increase the cost in a big way. So people will be impacted directly. And one thing that we also must bear in mind is that the banking sector is looking at the entire economy and how this will impact the local currency as well, because how the fluctuation will be too big. And I know the rates, the bank rates, and all that goes with all the banking sector will have to be really looked into. So whatever happens with the bank, whatever happens to the currency will impact our import, will impact the export as well, but more import because we depend a lot on import. So all these will have a big impact on our economy, and also will bring us to think as well, to what extent do we, for example, in terms of food security, how much will we have to start growing again locally? Because we have gone into this comfort zone of saying we can import everything. But right now, there is a rethink as to how much we can import, how much we should import, and how much we need to produce locally.
The UN, for example, has established a strategy and 5 different pillars where developed countries should support. So these 5 pillars are the following. First one is health, obviously protecting health services during the crisis. And here there is an interesting fact, because I was speaking with the director of the health unit of the Spanish Development Office, and she was explaining me interesting insights that usually for health, the traditional development has been focused on primary healthcare, right, on basic healthcare. And we have to recognize that in low-income countries in the last decades, there is already a strong network, for example, of health community workers in order to stop the impact of different diseases, right, in this case. And on the other side as well, you have philanthropic foundations like the Bill Gates Foundation and others who have been creating big health funds, but focus on niches, right, on let's finish malaria, let's finish HIV, without having in mind a comprehensive structure of the national healthcare system, right? Therefore, at the end, the development mechanism have forgotten to invest in advanced services, for example, in advanced medical healthcare management services. Because if you want to manage a ventilator, for example, to treat COVID-19, you need to have intensive care, right? And you need to have human capital who know how to manage themselves in an intensive care unit at the hospital. So those advanced services have not been received so much investment, right, in terms of health. So that should be a change that maybe in the future should vary. The second pillar is protecting people. And here the social protection safety net networks will be very important, especially to cover, to increase the food supply and the access to food. As we said, that would be one of the risks for those ones who need income or who are in extreme poverty, or as well basic services like education, right? So those ones will be very important to support. The third one is economic response and recovery. And here we come, we have points like informality, how we can support informal sector workers, right? As we said before, is very important because they do not have insurance, they don't have the safety net, sometimes they are unknown, and how you can protect small and medium-sized enterprises, right? To protect jobs and to keep the economy ongoing. The fourth one, which requires multilateral collaboration, is the macroeconomic response. And here for example, remittances. So in remittances, there are some things that can be done. One is to reduce the cost of remittances. So I was reading some data before this talk, and I realized that, for example, in average, the cost of remittances is between 6 and 8% of the amount in some countries, in low-income countries in Africa. That means that is a huge cost, actually, that you are paying. Is the transaction cost of that remittance is high, right? So during this crisis, something that developed countries can do is to reduce that cost, or the transaction cost of the remittances. And as well, something that will have a huge impact is that, look at Trump and in the US, how much they are pushing and putting some stigma on migrant workers, right? On migrant workers. But those ones are very important to protect, because if you protect their livelihood, their jobs, their income, then the remittances will increase as well. So it looks like, everything is somehow sometimes interconnected.